This video is for general information only and doesn't replace advice from your GP or pharmacist. If you have any concerns about your health, please seek professional guidance. Have you ever wondered if the food you eat could stop your body from absorbing vitamin D properly? It's a really common question, and the answer is more nuanced than you might expect. Vitamin D plays a vital role in your health. It supports your bones, helps regulate calcium, and keeps your immune system functioning well, but getting enough of it and actually absorbing it isn't always straightforward. Here's the key thing to understand first. Vitamin D is a fat-soluble vitamin. That means your body needs dietary fat and bile salts to absorb it properly in the small intestine. Without some fat in your meal, absorption is less efficient. This is the most significant dietary factor when it comes to vitamin D uptake, and it's well established. Now, you may have heard that certain foods like high fibre grains or phytate-rich foods such as legumes, nuts and seeds can block vitamin D absorption. There is a theoretical basis for these concerns, but the clinical evidence in healthy people eating a balanced diet is actually quite limited. At typical dietary intakes, these foods are unlikely to cause meaningful interference, so there's no need to start avoiding whole grains or lentils. The nutritional benefits of those foods far outweigh any theoretical risk. What about caffeine? Some research suggests high caffeine intake may influence calcium metabolism, which could indirectly affect vitamin D function, but the evidence is inconsistent, and moderate caffeine consumption is unlikely to be clinically relevant for most people. Alcohol is a slightly different story. Chronic heavy alcohol use can impair the liver's ability to process vitamin D, affect fat digestion, and damage the intestinal lining. Keeping within UK low-risk drinking guidelines reduces this risk, but if you have alcohol-related liver disease, it's worth discussing your vitamin D status with your GP. There are also certain medical conditions and medications that can significantly affect vitamin D absorption or metabolism. Conditions like celiac disease, Crohn's disease, and having had bariatric surgery can all impair how well your body absorbs fat-soluble vitamins. Some medications, including bile acid sequestrants, orlistat, and certain anti-epileptic drugs, can also interfere. If any of these apply to you, speak to your doctor about monitoring your vitamin D levels. So what can you actually do? A few practical things worth discussing with your healthcare professional. First, if you take a vitamin D supplement, take it with a meal that contains some fat, something like eggs, yogurt, or a drizzle of olive oil. This can help improve absorption. Second, in the UK, it's recommended to consider taking a daily vitamin D supplement during autumn and winter, when sunlight isn't strong enough for your skin to make it naturally. Speak to your pharmacist or GP about a suitable option for you. Third, if you're in a higher risk group, for example, if you have limited sun exposure, darker skin, a malabsorption condition, or you're taking medications that may interfere, it's worth asking your GP about testing your vitamin D levels and whether additional supplementation is appropriate for you. To recap, vitamin D needs dietary fat to be absorbed well, so take supplements with a meal. Foods like whole grains and legumes are unlikely to cause significant interference in most healthy people, but certain medical conditions, medications, and chronic heavy alcohol use can genuinely affect your vitamin D status, and those are worth discussing with your GP. If you have any concerns about your vitamin D levels, please speak to your GP or pharmacist rather than self-diagnosing. Have you ever had your vitamin D levels tested? Let us know in the comments below. And if you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more evidence-based health information.